Good evening, and thank you for joining us this evening for the Triton Parent and Families webinar. This is a chance for us all to gather and share some information of what we've been doing over the last few weeks to get ready for remote learning and also in response to the COVID-19 national and international situation. There will be a question and answer period that will follow. So please, as this evolves, please write down your questions and enter them through the Q&A portion. Next slide. Okay, this session is being recorded. This will also give you an opportunity to pick up any information in case it goes by or you want to refresh some images. There'll be some links we're going to provide for you and contact information. So those will be useful tools. So you may want to refer back to this session in the future. We have a very nice panel gathered for you today with a number of individuals who have been working very hard on the campus to really support our students and each other through this process. Dr. Robert Schooley is the Professor of Medicine, Division of Infectious Disease and Global Public Health and Interim Faculty Director for Global Education. And he will be giving us a real up-to-date view of the COVID situation around the globe. I am the Interim Executive Director for Student Health and Wellness, and I will be sharing some of our activities in the cluster that we're doing to support the student body. Dr. Patricia Mahaffey, the Assistant Vice Chancellor for Student Life, joins us, as well as Dulce Dorado, who leads our International Student Programs Office, and ABC Adele Brumfield, who is the Associate Vice Chancellor for Enrollment Management, and Dr. Williams, who's the Interim Assistant Vice Chancellor for Student Retention and Success. So this panel will be moving throughout the presentation. You'll hear from each of us, and then we will move to a question and answer period. And please use your Q&A tool at the bottom of your Zoom. We'll begin that shortly after 5. We will not be using the chat function. So we're going to start off with Dr. Schooley, and he's going to provide us with an update on COVID-19.
Good evening. It's very nice to be with you tonight, and I thought I would spend a few minutes talking a bit about the virus, placing it historically in the context of some of the other challenges we've had on the globe, and then giving you some idea about where things are going here in Southern California. The virus, coronavirus, gets its name because when you look at it under an electron microscope, it appears as an oval-shaped object with spikes that make it look like a crown. Hence, coronavirus is how we have named it and known it for the last 50 years. Until about 20 years ago, the strains that were seen in humans were viewed as being relatively benign and tended to cause common colds. But about 20 years ago, an unusual variant of this virus family emerged from bats, where large numbers of variants of this virus live, into humans, and caused the first outbreak in this series called SARS, or Severe Adult Respiratory Distress Syndrome. This was initially discovered in South China and spread as far as Toronto before it was stopped, mainly by intense efforts to isolate people who were infected and their contacts, and after about 8,000 cases, this epidemic was ended. About 10 years later, another related virus, known as Middle Eastern Respiratory Syndrome virus, or MERS virus, emerged in Saudi Arabia, and it caused the same sort of an illness in about 2,500 people before it was stopped by the same epidemiologic means. In late 2019, the third member of this family, SARS-CoV-2, named this because it was much more closely related to the initial SARS virus than to the MERS virus, emerged in South China again from the same sources. This virus has now caused about 2 million cases of infection that we've counted, but undoubtedly more infections that we have not around the world. It has been associated with at least 125,000 deaths. Now, we know from the experience in China that while the virus infects the population broadly, you can see in the histogram here that in China, the median age of those who were diagnosed is in the mid-50s. It's most severe and causes the highest fatality rate in people who are older. This is a feature of all of these coronaviruses, and we don't yet understand that, but it's one of the things that's quite true. Next slide. Now, in the current coronavirus outbreak, the symptoms that are most frequently seen and that bring patients to our attention are fever. We see fever in about 80% of patients when they are first coming to diagnosis, whether they are people with mild disease or severe disease. We see cough in only about 40% of people. About a third of patients will feel fatigued. But many of the other symptoms that we see with typical influenza, which include sore throat and productive cough, runny nose, are seen much less often. Most people do very well with this disease. 95% of people recover. You can see in this cartoon put together by Dr. Zhongyu Wu of the Chinese CDC that about 40% of people will have a mild case of illness when they come to see the physician for the first time. And most of those patients get well over a course of 3 days to 10 days. About 40% of people will also come with moderate disease. These tend to get better. But people in both groups have a subset of people who don't do well and can go on to the intensive care unit and die. A smaller fraction appear with severe disease. Some of them do well, a lower percentage do, but a higher percentage do poorly. And disproportionately represented in these patients are people who are older and people with underlying diseases such as hypertension, diabetes, and obesity. Next. Now, just to finish and say something about where things are in California, this is one of the indicators of how much disease we have in different parts of the country. And you can see in the red line, probably easiest demonstrated on the right slide, the epidemic curve in New York. This is a logarithmic scale rather than an arithmetic scale. So each of those big cross lines is 10 times more cases. And you can see that California is lagging significantly behind New York, as it has from the beginning. And this is because California instituted its social isolation or social distancing policy much earlier in the epidemic than New York did. And we're continuing to benefit from this because the earlier in an epidemic you institute measures to slow the spread, the more benefit you get. And finally, this is the situation in San Diego. You can see that we've had a relatively small number of cases here in San Diego. We seem to be turning the corner with fewer cases appearing daily. We're still having patients in the hospital, but again, because of the early distancing, San Diego has fared quite well, and we're very proud of our students and of our population at large for the impact that these efforts have taken. And finally, this just shows you the country as a whole. Again, the display between New York and the blue line and California and the red line, or in the with the red arrow. We're continuing, I think, to do quite well. This is a growth curve from about 10 days ago. The rate of growth in California per day has now fallen to 5%, and we anticipate it will continue to improve. So in planning for this, Dr. Socher will now pick up and tell you some of the things that we've done.
We've been following the CDC guidelines as well as other scientific information as evolves and responding quite actively within the campus community. Instruction has converted to a remote process for all of the courses through spring quarter as well as summer quarter, and we are actively assessing our options for fall of 2020. Postponement and cancellation of all face-to-face interactions, large gatherings has occurred. And we are following the travel restrictions for CDC level 2 and 3 countries and asking our students and faculty to avoid all non-essential travel. And we are socially distancing within the campus community, and people have been very attentive to this and very responsive. And as Dr. Schooley emphasized, this has made a huge difference in how San Diego is performing. Next slide. I'd like now to hand off. Next slide. So we're going to cover, go back one, I'm sorry. We're just going to, these are the basic things that we will work through in the next 45 minutes with you. And there will be multiple of us will hand off to each other as we move along. Next slide. All right. Dr. Williams will begin the community discussion.
Thank you all for joining us today. UC San Diego's Principles of Community. We want to remind everyone that first and foremost, we are a community that cares, and the Principles of Community serve as the foundation for our relationship to one another, and they must continue to be upheld in the highest regard. Really what we would like everyone to understand is we are working very diligently to make sure that everyone in our community, no matter what their background, has a place and is respected and seen as a valued member in our community. We also are providing technology as to support our remote education. So the fact that all courses are happening remotely, including labs, studio classes, small group discussions, and seminars, are them being delivered online. We have a couple of different tools in which we're using. So your students will be using Zoom and Canvas as technologies in which to connect with getting classes in real time or with recordings. Canvas to have communication and learn, get other access to teaching equipment and information for their classes. Some faculty will also be using podcasting. You can visit our educational continuity tools and resources to learn more about resources that are available for our students as they make their way through this remote spring quarter and now remote summer. We've also set up an opportunity to support students in this remote learning environment. We have a laptop lending support system. If your student is having difficulty with their technology or accessing the remote instruction, please have them email vcsa@ucsd.edu. We have given out a significant number of laptops. We still have some available, and we're happy to support students in that way. There may be some other technical needs for remote instruction or that may come up. We encourage you to use that same email to let us know what other things are challenging your student from being able to participate successfully in this remote instruction time. So vcsa@ucsd.edu. With that, I'd like to turn it over to my colleague, Dr. Mahaffey.
All right. Thank you, Dr. Williams. It's good to be with you all today. Hello. Our unique undergraduate college system provides a really wonderful web of support for our students. So if your student is having any issues academically or non-academically, the colleges are uniquely situated to support and connect your students to the appropriate resources on what can be a very large and complex campus. So each of the colleges have a Dean of Student Affairs that are able and available to help your student, and we've provided their contact information on this slide. Conversely, our campus student leaders have been very integrated with campus leadership, and they help to communicate both to inform us about the student experience and then to also communicate with students things that might be happening at the leadership level on campus. Next slide. There you go. And then also our graduate students have an Assistant Dean of Student Affairs in the Graduate Division. Her name is April Bjornson, and she is also available to help support your students if they are in any of the graduate programs or pre-professional programs. We also have our Graduate Student Association President, Rachel Flanagan, who's also a great resource for your students if they are in any of the graduate programs. Next slide. And then finally, staying connected to campus is super important. And if you have not already, we encourage you to sign up for Triton alerts. Whenever the campus community needs to be informed regarding any emergencies or critical information, we will utilize our Triton alert system. And if you sign up, then you, along with your student, will also receive these timely alerts. We also encourage you to regularly visit our campus coronavirus website, where we are updating that information frequently. So now I'm going to turn things over to Dr. Sosha to discuss the support and the effort that's happening within our student health and wellness area.
Thanks very much. I do see some questions about whether the information is going to be available to you because of all the contacts, and yes, it will be. So I don't want you to feel you have to write down with a pen and pencil all this information. This is being recorded, and we will be sharing the slides in the presentation with folks. So the Student Health and Wellness team has been working very hard to make sure that those services on campus which are important to deliver in person are active and safe, as well as to make sure that we also are supporting those students that are remote and away from our campus. The Student Health Service has a 24/7 available line. This is responded to by our nurses, and it's available to all students regardless of an insurance. And we particularly want them to use this line if they have any concerns, they may have any symptoms of COVID-19 or been in contact with someone with COVID-19 about next steps. We encourage them to call us before coming into student health so that we can appropriately prepare for them. We have our standard operating hours during the day. We have segregated care in the Student Health Center to respiratory and non-respiratory. They come in through different doorways. Everyone is screened and masked appropriately, and they do not cross over each other. Our team has full PPE and they are well protected, so care is quite safe. We have primary care going on as well for those services which are essential and timely. And we've developed telemedicine so our students can communicate with their primary care providers, and that is up and running very smoothly. Women's health and sports medicine is also available. The next slide, please. We have a lot of other services in the Student Health Center, including a laboratory, which does continue to have self-directed sexually transmitted disease testing. Our X-ray service is open, and our pharmacy is busy. And they've actually developed the ability to fulfill prescriptions for 90 days, rather than the normal 30, and they can mail these prescriptions to homes off campus within the state of California. Our pricing is often actually less than you'll find at a commercial drugstore or pharmacy. So we encourage our students to continue to use the student health pharmacy. Optometry team will send contacts and replacement glasses. Unfortunately, right now we cannot do in-person exams. Next slide. Medical records, if a student needs their medical records, they go into our My Student Chart, that's our electronic medical record, and they will get those out to the student as needed. The insurance team is fully operational and working remotely. If you have any questions about insurance coverage, particularly SHIP coverage or any other fees related to medical care. Next slide. The CAPS team has really stepped up and has gone to almost completely remote support with both psychological and psychiatric counseling services available remotely. They do a telemedicine or telemental health platform, so they have visual as well as auditory connections with the students. This is in a secure platform within our electronic medical record. They're also doing some group therapies. But we also have on campus the urgent care office, which has a core staff. So if a student needs to be evaluated in person, that team is open during the weekdays. There is also a 24/7 line that is always answered, and CAPS providers are on call 24/7 to address student needs in the mental health space. So the team is ready and there for your students. Next slide. Our health promotion team has moved all of its programs to a virtual platform. There's quite a bit of activity going on there, and we encourage that students take advantage of all these different podcasts and other things that are really about keeping healthy during this very stressful time. I'm now going to move into some of the things we've had to do to adjust to the COVID-19 situation clinically. Can I have the next slide, please? So we do have testing. We're very fortunate that we are working with the health system to have testing available to our students. We are following CDC as well as San Diego Public Health guidance, and we want to make sure that the care we provide is consistent with the evolving science and meets the highest standards. So students who have symptoms, again, we want them to call us, we'll give them advice, and then they can come in for testing. The testing is done on site, and we have our results within 24 hours. We realize how important this is, and we've made COVID-19 testing available for all students regardless of insurance. It's important to remember that the student health service is there for all students, not just those who have the SHIP insurance. SHIP insurance does cover 100% of all COVID-related testing and treatments. Many other insurances have also waived any co-pays for students. So if you have questions and you're not in the SHIP system, you may want to talk to your insurance company directly, and we will work with you if the student has testing at student health. Next slide. We had to face the situation of how do we keep a student who needs to isolate themselves, either because they've been in contact with someone with COVID-19, or they traveled and they needed quarantine, or they themselves were diagnosed with the virus. So we've identified some safe campus housing, which allows the student to have their own bathroom and bedroom. They get full nutritional support with meals being delivered 3 times a day, as well as daily clinical check-ins and other support services. This system has worked extremely well. We've been very fortunate that very few students have needed it, but we wanted to make something available for our students who live on campus and needed to be in a safe, isolated setting. Next slide. So we're reminding all of our students in our community to wash their hands very frequently, either with soap and water, and if they don't have that available, use hand sanitizer, cover their coughs with a tissue, dispose of that tissue, or use your sleeve if you happen to be without a tissue. We want to avoid touching our face with hands, minimize touching others as well, and that it's important to stay healthy, which includes good sleep, some regular exercise, eating well. If they should avoid contact with ill individuals, all right, and also be very willing to come in for testing. It's important to know if you have acquired this virus that you take care of yourself and you avoid exposing it to anyone else. We are encouraging students as well as other campus individuals to wear face coverings when they're in public. We are saving our masks for our healthcare providers to make sure that they stay safe and available to our students as well. All right, I'm now going to ask Dulce Dorado to speak to how support for our international students.
Hello, everyone. I wanted to share that the International Students and Programs Office remains open in terms of all of our advising services, document processing, and mailing services for our international students are available remotely and online. There are 3 important ways to contact our office. One, for students that have questions about any of their travel, enrollment, employment, or any of the visa regulations. They can meet with an advisor via Zoom conferencing, and the best way to do that is visit icontact.ucsd.edu, or students can also email our office at istudents@ucsd.edu. And of course, our website has a lot of information related to those information. And we do have a frequently asked questions and answers website for international students, whether you're in the country or outside. Next, I'm going to go over some of the most frequently asked questions from our students and parents of our international students. Number 1, ISPO continues to issue Form I-20s and Form DS-2019s. These are the forms that our international students need in order to apply for a visa. So we're continuing to issue those for all newly admitted fall 2020 students. And we do host a variety of pre-arrival webinars to help students prepare for the upcoming academic year. So please continue to visit our website for that information. In addition, for all continuing students, whether students are here at UC San Diego or in San Diego, or whether they're outside of the United States, students can engage in remote learning and maintain their immigration status. So our office continues to keep those records active to ensure that students are maintaining their records. The third area would be for employment. So students that are either working on campus remotely, or if they're on post-completion optional practical training or STEM optional practical training, these are the types of employment authorization that our alumni are able to obtain so that they can work in the United States. Students are asked to consult with their employers to seek alternative ways to maintain their employment. So in other words, teleworking or working remote. In addition, our office does continue to accept and process employment authorization requests. So please continue to submit those to our office. And lastly, what I wanted to cover is another frequently asked question of our office, our travel considerations. So if students are staying in the United States and are enrolled in the spring or summer term, their SEVIS record or their immigration record will remain active. So those records will remain active if the student is here in the United States. On the other hand, if students return home and are enrolled in spring or summer term, we will also keep those SEVIS records or immigration records active to ensure that students can utilize their records. On the other hand, if students return home and are not enrolled in the spring or summer, then our office will end the record with an authorized early withdrawal. When the student then is ready to return to UC San Diego or ready to enroll again as a full-time student, our office will then issue a new document called a Form I-20. Again, all of this information for all either new or continuing or graduating students is available on our website, and the link here, ispo.ucsd.edu/news coronavirus info, will have all of the frequently asked questions and answers for our international students. So next I want to turn it over to Assistant Vice Chancellor Patty Mahaffey, who will talk next about housing and dining.
Hello again. Housing and dining services are still open for spring quarter. Many of you already know that your students have been encouraged to move home for spring quarter, though there are some students that are remaining on campus. We have probably just a little over 5,000 students on campus right now, and that includes our graduate students. Students who had canceled their housing received a prorated refund based on their move-out date. They had to submit that by the end of March. And those reimbursements are happening. They are manually done, so they take a little bit of time. Students who did cancel their housing contract and they have a 2-year guarantee will be able to keep their housing contract for fall 2020. Our dining facilities are still open, and we are encouraging social distancing and really encouraging students to use Grubhub to pre-order their meals for pickup. And just get grab-and-go food items on the on-campus markets or in the university centers. And of course, we've increased our sanitation protocols in all of our dining facilities. Next slide. So we know some of our students may be disproportionately affected by the impact of COVID-19, which has led to several campus life and academic changes. Our basic needs really refers to the essential resources that's required to thrive as a student, and that includes access to nutritious food, stable housing, financial wellness. On our campus, we have a vast array of robust basic needs services. Any student who's having any difficulty accessing enough food to eat every day or who lacks a safe and stable place to live, we really encourage them to reach out to our Basic Needs Hub. They can either email at basicneeds@ucsd.edu or call the phone number or visit the website. Right now, students can visit the Basic Needs website and complete a COVID-19 Special Relief Fund if they are impacted, or the Basic Needs Assistance Form. We know many of our students have lost their job during this period of time, and that's affected their ability to meet their basic needs. So we can get them connected to resources such as financial support, CalFresh application information, get them connected to the Triton Food Pantry, which is also still up and running. All they have to do to access the food pantry is to go online and fill out a simple form about the items that they'd like to pick up. and a grocery bag will be assembled for them, and they can come by at an appropriate time and pick up their food bags, grocery bags. So it's really simple, and they can visit. They can either email foodpantry@ucsd.edu or visit the Facebook page. Also, during spring quarter, we are operating a grocery shuttle every Tuesday from 10 to 4. So if students that are in the area, they can jump on the grocery shuttle that will bring students to local grocery stores to get food and essentials. And we're also setting up to do some mobile pantries in the local San Diego area, especially where our off-campus students are clustered right now. Next slide. So our teams have worked hard to pivot and provide programs and services virtually. That includes the development of a virtual student union, which will be sort of a one-stop shop to find out information across the campus about a variety of different virtual co-curricular programming. Such as some of the programs we're doing are the iLead program, which is continuing out of our communication and leadership area. We have a dialogue program. We have many robust programs happening out of student health and wellness in that area, and our student retention and success area that will all be linked on that virtual student union. Our recreation department developed a really robust quote unquote playground where they're linking students to a variety of off-campus virtual experiences. And they've launched an esports experience as well. And we're helping keep students informed with our very popular Student Events Insider, which is an email that we've now aptly renamed the Student Events Stay Insider. So it's got great information about campus, what's happening across the campus from different departments and different student organizations and student life in general. Next slide. Our associated students are working very closely with campus administration to help elevate student concerns as the campus really leans into this remote learning environment. There are meetings that are held regularly. Their meetings are weekly and are live on Facebook, and we encourage our students to check that out. Concerts, webinars, and movie nights are all just some of the programs that are getting planned for our students as well. All right. Now I'm going to turn things over to our Associate Vice Chancellor for Enrollment Management, Adele Brumfield. Thank you.
Thank you so much, Dr. Mahaffey, and hello, everyone. I'm happy to talk with you a few minutes about parent and family programs. It's one of the units in my portfolio, and it is really a program designed to be a connector with many of our campus units and you, parents and families. I'll just take a moment and just read our mission to you. We are committed to make UC San Diego accessible to families of undergraduate students because we recognize the important role families have on their students' education. We do this through the development and implementation of targeted services, resources, and programs. We're really accessible to answer your question. Our team is here to provide guidance to resources and facilitate campus connections. We try to assist families in finding their way around campus, especially if you're far afield and you may not be as familiar with things that your students are. We're here and we welcome your questions to support your students. For example, we tend to receive questions from families about how parents and families can help their students connect with an academic advisor, how students can make an appointment with health services, our nurses, as you heard about today, how they can even manage their time better with classes, work, and social activities. And this may be a different undertaking now since we're staying at home and many of our students are back home with you or they're remote. So we're here to help in that regard. We're also connected to campus partners, and we try to really help you be more involved in the UC San Diego experience. We look forward to a time when we can welcome you all back to campus, when we are able to see firsthand how we partner with alumni, how we work collectively with the colleges. We can't wait for our sports teams to get back on the courts, in the pools, in the fields. And then we look forward to homecoming in the fall. We also partner with our International Students and Programs Office. You've heard from them today. And then even on parent and family giving as we plan international parent and family orientation. In addition, we partner with Student Financial Solutions, financial aid and scholarships, as well as health services. We're trying to really be a hub to publish lots of information. As we think about some of the opportunities, we have it on our website. And the website, if we can go to the next slide, please, is accessible in multiple languages. And it's also accessible. There's a parent and family guide. May I have the next slide, please, if that's possible? Thank you. And as I've mentioned, available in multiple languages. You see our contact information there. And as you've heard before, we will share this out with you. So please reach out to us. We're available Monday through Friday, 8 a.m. to 4:30 p.m. Pacific Daylight Time. And we value your involvement with your students' Triton education. We know that no one can do this alone, and we know how important you are in supporting your students. Again, we can't wait to see you in person or in the time being virtually. And please watch for additional communication from our team about upcoming events. And so with that, I'd like to pass it along to my colleague, Dr. Williams.
Thank you so much, Associate Vice Chancellor Brumfield. I have the pleasure of talking to you about academic support of your students that are currently here and in classes, at home, remotely, as we are staying safe. Our campus is committed to the retention and engagement of our students. So in order to support that, Student Retention and Success website that I have listed here has availability for students to get one-on-one appointments with advisors, coaches, and mentors. There's also some workshops available for shared studying and etc. So please feel free to visit our srs.ucsd.edu website and look for Spring 2020 support. A group of us together across the campus came together to put some resources together in a weekly podcast that is now being shared, and you can visit that at Triton Tools and Tidbits. Things that you'll find at Triton Tools and Tidbits will include tools that support our students' current success as they navigate this remote space, but also as they prepare for once they leave UCSD. So we have a full set of programming prepared for the remainder of the quarter, and all podcasts that have been promoted, that have been published, will be found at this website, so they can visit at their leisure and there's no time constraints. Next slide, please. Other things that support, we've heard a lot about about health and well-being. But when we think about health and well-being, there are other aspects to it other than just our health services, and we collaborate with them. We also have counseling and psychological services that your students can engage in and are prepared to support from a remote space. They can visit this website, wellness.ucsd.edu/CAPS, to find out more information on how to schedule an appointment or make time in the space they'd like to connect with a professional. There's also the playground. We are all experiencing the space where we may not be moving as much as we normally would be moving in different conditions. And so our playground that was created by our recreation department allows for you to engage in movement and activities while we are healthily practicing distancing, but still staying socially connected. Housing and dining for students that are still on campus has a wellness page as well that's providing programming events to also support students here. So we're very aware that people are in need of community and in need of support and exercise engagement and professional support. So these are the resources I wanted to add in addition to the resources you've already heard during this webinar. Next slide, please. We've heard about our colleges. We're so excited to have our college system here at UCSD. Separate from connecting with our advisors and the other functions our colleges do, all of our colleges have created virtual support experiences and interactions for your students to engage in. If you know which college your student is a member of, you can go to their specific page. If you're not clear, you can, of course, ask your student, or your student will know. You can also visit the virtual college programming website, which is here in the box under our college's logos, which will let you peruse through the different variety of virtual community that our staff is engaged in to be sure that our students stay connected and know that we are all Tritons getting through this particular part of the world together. So there's a lot of fun here. You can see they've come up with fun names like Roger That and Soar. So we're excited to have that. Please visit and have your students visit and learn about the things that we're providing on the top of our class space. Next slide, please. So experiential learning, most all of us know, and if you don't know, in classroom takes us so far, and then people want to have the opportunity to apply those in classroom experiences in the real world. So experiential learning is a way to reinforce that. Academic internship program is looking at ways to have remote internship opportunities for our students. You can visit what they are doing at aip.ucsd.edu. If your student or if the students on would like to make a particular appointment with them, they can be reached through the Virtual Advising Center, which is available 24 hours to students. We have something called the co-curricular credit. And if you're doing credit for activities outside of the classroom and you'd like that to show up on your transcript, that's what our co-curricular record is for. If students are curious if something that they're doing can count, even in their home community, they can email elt@ucsd.edu. We have remote undergraduate research opportunities. You can find opportunities through aep.ucsd.edu. That's our academic enrichment program. They've worked very extensively with faculty to come up with engaging ways to still have our students participate in the research of this Research One institution and be able to further enhance skills for what their next steps in life will be. All of these things that I've shared with you are the pieces I wanted to highlight, but more information is also available at Real Portal, which I'll have a more extensive and is constantly updated around what our students can get engaged in outside of the classroom, which we call experiential learning. So real.ucsd.edu. Next slide, please. Additional support that your students will receive or can receive here is, I mentioned the Virtual Advising Center. That existed well before we were in this situation, and what's great about that is you can ask a question 24 hours a day. So if at 2 in the morning you have a question that is something that needs to be answered, it will get addressed. We also have the Office for the Students with Disabilities, osd.ucsd.edu. This is a resource for students with documented, temporary, or permanent disabilities to receive remote accommodations. Some people may be having a harder time with remote, and they're prepared to take care of and support those students and advocate for their success in leveling the playing field. We have some academic writing support through our Teaching and Learning Commons. We highlighted this one because they do one-on-one and group support for students who might be having challenges writing essays or need support in writing heavy courses. They also offer other things that support our students. And last but not least on this slide is our libraries. Yes, our libraries are closed to keep people safe, but they are not inactive. So you can see what resources are available for library resources through their library.ucsd.edu/ask-us. You can explore that space. And at that same URL, you can dig to find some connections for a meeting with a librarian. So if your student is doing research and needs that type of some support there, they would be able to talk to a librarian about what resources are available to them remotely and how to support them. They also offer several other resources, and some of those include access to technology or software that you may need for classes. So I encourage people to visit that website. Next slide, please. So these are the other helpful websites that are available to our community to support each other during this time. You have UC San Diego coronavirus website and has a lot of different information there, and it's constantly updated. The Student Affairs has curated a set of information that's been highly resourceful for students to have access to information that will support them during this remote learning. We have our international students coronavirus webpage, which supports our international students around specific issues that pertain directly to them. And then we have Educational Continuity, which is a group of individuals who are coming together to support the fact that we're in this remote space, and how do we keep learning and stay engaged as a community. With that, I'm going to turn the floor over to Dr. Sosha to moderate our question and answer period. Thank you for listening.
Thank you, Dr. Williams. We have a couple questions here about our graduating students, specifically commencement thoughts of whether that will happen and how. And the other piece that a couple folks have asked about, any tools for our graduating students who are looking for jobs, and now that we don't have the classic on-campus interview process. Can we speak to, I think the first thing might be commencement. My understanding is there is conversation about commencement being later in the year, and it hasn't been finally decided. Perhaps.
Yes, that's my understanding as well, that there are committees that are reviewing this right now. But the reminder is we are following state guidance as it relates to large gatherings. So I believe that there will be more to come soon.
Thank you. Dr. Williams, anything about the job search challenge that these graduating individuals are facing?
Well, I am glad that you asked that question. One of the topics that we brought up for one of our podcasts that will come up in the future is engaging career services around that time and space. We had a similar similar scenario some years back, and so we're looking to engage alumni on how they navigated that space. We believe that we've known and seen people to continue to get hired and get placed. Some of their start dates are pushed a little further down the road for when they can be in person. But the companies are engaged. Our career services and staff are highly ready to have those conversations, and we're putting out information on a regular basis around engaging that space. Thank you.
Thank you. Dr. Mahaffey, there are some housing questions here. One for the students who gave up their contract and the refunds. Is there a rough idea when the refunds will be processed, so people, they don't want to bother you, but they'd like a rough idea of when they might see those refunds? That's the first question. And the second is thinking about the fall. Folks are wondering, will housing be available for if we are able to be more of a on-campus presence for third and fourth year students? Is there going to be a change in practice for next fall? So two questions.
So I'm going to defer the question about the cost to AVC Brumfield and see if she can answer that one. But in the meantime, I can't answer the other housing question. We have a really robust off-campus housing website and an off-campus housing office. We'll be doing an off-campus housing fair a little bit later this quarter that we'll invite all of our students to. So that's a good place for students to get connected to off-campus housing. Our off-campus housing partners, many of them we are reaching out to, and they have been very flexible with lease start dates and understanding that we will be remote for spring or summer session, and coming back in the fall is the plan. But they're working with us and working with our students pretty closely, so that's good. And we will have that off-campus housing fair that will be helpful to getting students connected to off-campus housing. For on-campus housing, a lot of that's going to remain to be seen, what it looks like for students that will choose to live on campus for their second year, and what it looks like for capacity on campus. I don't think we have a clear picture of that yet. If there is room that we can house our third and fourth year students, we will definitely do that. But our priority will be to our first year incoming first year students and transfer students, and then also our students with a second year housing guarantee. But if your student is really struggling at the beginning of the year and is just not able to get situated, definitely reach out to our off-campus housing coordinator, and we will help to get them situated.
That's great.
And I'm happy to answer the question about the housing refunds. That process is underway right now. It's a collaboration, Campus Financial Solutions, financial aid, registrar. So I would say the hope is within the coming weeks that will be resolved. It has been a manual process since it's nothing we've done in this magnitude before, but we understand that people may be anxious, and we're doing our best to get through that work as quickly as possible.
Thank you. About how many students are still living on campus?
We have a little over 5,000 students. It's probably close to 1,500 undergraduates, and the rest are graduate students. So a lot of students took us up on the encouragement to move off campus.
Great.
And I would just add and reiterate that for those who are staying on campus, we're very mindful of social distancing, and we're making sure that we're adhering to the guidance from the state and from the CDC.
Thank you. There was a question about have we had any COVID positive students on the campus, and I'll take that, and Dr. Schooley may add some additional information here. We've had a small handful of students who have tested positive for the virus. They have all done very well clinically. And I would also like to share that we began testing our students very early at a time when many individuals could not even have testing. We began almost a month ago. We did this because we knew that they lived with multiple other individuals and there was a risk that they could inadvertently spread this to other students. So our testing criteria, we began at a time when they wouldn't even have been tested if they were out in the regular community at a regular doctor's or clinic office. So I think the fact that we picked a few up was because we began testing. And as you've seen on the national news, that testing is critical in managing this disease. So we were out front of it early. We therefore found a few students. We were able to isolate them, support them, and control and avoid any significant spread of the virus in our community, in our campus community. Chip, I don't know if you want to add any more to that conversation.
No, I think that's very accurate. We're part of the San Diego community, and we've seen a few cases, and our students have done very well and are now back doing what they were doing beforehand. So we're really glad they did so well.
Thank you. Thank you on that one. There are a number of questions about will there be refunds from the spring because of the remote world? And I think that we can say that right now there is not a discussion of there being a rebate, that what we've tried so hard to do is to actually bring all the services to the students wherever they are. I think others may want to add to that conversation. Maybe not.
Well, nothing to add specifically on that. I think you answered it very succinctly. I will add, though, I've seen questions about change in income as it relates to COVID-19 and the challenges families may now be facing. If you have seen job loss, experienced job loss, if there are any financial issues that your family is facing, please contact Financial Aid and Scholarships. We have a team that will be able to work with you. They have processes in place that will address any sort of change in income and how that could impact your financial aid for the future. So please reach out to Financial Aid and Scholarships, and they will be happy to assist you.
That's great. Thanks very much for adding that. It's an important situation. Many of our families' financial picture has been impacted by this virus. All right. There's some questions here about the study abroad programs for the fall. Dulcie, would you want to comment on that? Has there been a decision made about study abroad programs for the fall quarter?
Yes, Angela, Dr. Sosha. A decision has not been made yet regarding the fall 2020 study abroad programs. We're also relying on the University of California's Education Abroad program, but also all the providers that we're working with directly. But once we are aware of it, we will then notify our students and the campus.
There was a question here about summer programs being remote, and I want to confirm that the summer programs will be remote. And there's another good question here. How can students get into study groups with their individual courses? What would you suggest the student's path be to establish a study group?
Well, first I'd say that they should check out Triton Tools and Tidbits, because one of our episode last week talked about forming effective remote discussions, and it had some other discussions about identity. But I think reaching out to students in classes, looking at some of our other resources, OASIS, which you can find through the SRS, Student Retention and Services website, has some study groups that are connected to certain classes. Our Teaching and Learning Commons has availability for people to study in groups and one-on-one. I'd also implore people to use the chat box and information within their classes in order to connect with students to find out who's on certain timelines or time zones and go from there. So those are the techniques that I've heard of so far, and that's what I would recommend.
That's great. How about, there's questions about lab and practical classes. How do the faculty and how's everybody responding to that challenge?
That's a great question. With the lab and faculty classes, where we could, lab courses have figured out how to create remote experiences for students that can be conducted or observed, one of the two within within this remote environment. I know in engineering, some have taken to, just like ordering a school book, ordering kits in order for people to do that. So our faculty are being very creative. Students have been engaged in some of that creativity, and the goal is to make sure that individuals are learning what they need to learn as best they can given our current circumstances.
Thank you very much. Are most of the virtual classes occurring through Zoom or other vehicles?
I think the majority of the classes are occurring through Zoom. Canvas is also being used, and then some faculty are using podcasting. So those are the three main virtual tools that are being used to conduct virtual classes. The idea is that during the actual scheduled time, during Pacific Standard Time, the faculty will engage or have something available, but then they will also record and have other pieces available for people who cannot attend or it's inconvenient to attend at that time.
Thanks. We have another question about class drop deadlines. Is there any thought that this will change in the spring quarter?
Not that I'm aware of.
All right, thanks very much. If a student gets COVID-19, how you inform the parents? This is really a medical situation that the rules about medical confidentiality would apply in this setting. And I would hope that most students would share the information with their parents. All right, we're almost at the end here. I actually see, what's the probability of fall 2020 to start on campus in person? I think that is our hope, and that is what we are all working towards. So I don't know if anyone else wants to add more to that explanation.
No, I think that was a great answer, Dr. Sosha.
All right. Well, I think I don't have a question, but I have a great comment from one of our attendees, which is, let's end the year on a great note and have a hell of a commencement. I think that's a great idea. I think we're all wanting to celebrate coming out of this phase that we're in now. So I want to thank everyone, both the panelists as well as all of you who joined us this evening, for your questions, your attention. We want to be available to you, and if this is useful, please send us that feedback. We're more than willing to provide these periodic updates as we move through the spring quarter. So enjoy the rest of your evening, and thank you, everyone.